So a pleasant good day to the listeners of Tobago Inspirational Network. Yours truly, Dr. Jason Batson, the Senior Medical Director of Batson and Associates, with another program discussing health from a natural and integrated perspective. Now, there were some questions that, a lot of listeners always send questions to us. So there are a few questions that we're going to discuss today as regards to health and how you can actually get assistance from a natural and integrated perspective. So first of all, who am I? My specialization is primarily what is known as natural and integrative medicine. So I have a bachelor's in holistic health science, a master's in health science, and I completed a PhD in natural and integrative medicine. Now, let's say, for example, we're discussing a topic that affects so many persons out there. That is the topic of diabetes. What is the advantage that Batson and Associates offer to someone who has diabetes from an integrated perspective? Now, that was actually a question that someone had sent us, so we're going to start there. Now, when you're looking at diabetes, we have to understand that diabetes, first of all, whether you're talking about type 1 diabetes, which is where you have issues associated with insulin not being properly produced in the body by the pancreas, that is type 1 insulin. So in a case like that, someone who has that type of situation is actually going to be recommended insulin, or in some instances, insulin and medication. Now, if you're dealing with type 2 diabetes, which is diabetes mellitus, which is the most common one, then that individual would be recommended some sort of medication. So it would most likely be glucophage or diamicron or metformin. And you're normally recommended, most likely, if it's a 500 milligram, they tell you take 2 in the morning, 2 in the evening, or maybe 1 in the morning, 1 in the evening to make up 1,000 milligrams. Now, that is all well and good because you're now managing the diabetes. Now, one of the things we realize with diabetes is that there are a lot of complications associated with diabetes. How so? Now, remember, the mere fact that diabetes is a situation where you have high levels of glucose in the blood, it means that diabetes significantly compromises what systems? It compromises macrocirculation, which is circulation in the larger blood vessels, so circulation in the arteries, the veins, but it also affects what is known as microcirculation, which is circulation in the capillaries. So it's very easy for someone who has diabetes to actually reach a situation where they have a compromised circulatory system. So it means they tend to have problems where they could actually lose their limbs, so they could lose toes, they could lose their feet, or more than one, both feet, as a result of diabetes. They can also have serious problems associated with their eyesight. Because remember, if diabetes compromises one's cardiovascular and one's circulatory system, it means it's very easy to interfere with circulation in the capillaries, as I mentioned. So you find someone who has diabetes, it's very easy for you to end up with a situation known as detached retina, which is actually bleeding behind the eyes. It's very easy for you to end up as a diabetic with a complication known as glaucoma, which is high ocular pressure in the eyes. So the thing is, what you find with a normal diabetic center is that they're primarily going to deal with the symptomology, which is the elevated blood sugar. Now, that is good because we know when you get the sugar managed properly, you find that you tend to negate the negative effects that I just spoke about there, the effects of poor microcirculation and poor macrocirculation. But when you're looking at what we offer at Batson and Associates from an integrative perspective, one of the things that we help clients to appreciate is that if you're dealing with a diabetic situation, there are certain things that you need to pay attention to. And that is some of the things we're going to discuss. One, you need to look at dehydration in the body. So the question is, how much water do you drink? So obviously, as a diabetic, it would mean that you need to pay very, very close attention to your hydration. And the rule for drinking water is your body weight divided by 2 in ounces. So the thing is, at Batson and Associates, we're actually going to put you on a protocol, an integrative protocol to address this. Now, diabetes, as I mentioned before, is elevated blood glucose, and we have already established that you have different types of diabetics, primarily type 1, type 2. You also have type 3, 4, and 5. Type 3 being gestational diabetes, type 4 being early onset diabetes, and type 5 is when you actually begin to have problems with glucose intolerance. So you find 4 and 5 is actually more pre-diabetic than diabetic. So it means a lot of persons who actually are pre-diabetic before they actually become a diabetic. Good. Now, at the integrative practice or the integrative level, what we're going to do at Batson and Associates is first of all assess what is going on with you as it relates to your digestive system, because I'll explain to you shortly why is that so important. We're also going to evaluate your metabolic system as well. So determine if you have any problems with thyroid, parathyroid, pituitary, adrenal glands. The thing is, you may have done tests before and they have said that it is good, but if you are in fact a diabetic and you are seeing elevated blood glucose levels, then it means you need to take a closer look at the metabolism. And that is what we do primarily at Batson and Associates. So the advantage of our integrative diabetic clinic is one where we manage and ensure proper eyesight and maintain proper eye health. Also reduce blood glucose levels in both cases, whether you're a type 1 diabetic or a type 2 diabetic. Also improve blood circulation, microcirculation, because we know, as I mentioned before, one of the complications of diabetes is poor circulation because of elevated blood glucose levels. Very important. So it's a matter of now not necessarily treating the symptomology primarily, but actually addressing the root cause or the root causes of that particular situation. So that is where we look at from that perspective of diabetes. You can, of course, feel free to give us a call or visit. Keep in mind, the Tobago telephone numbers I always forget, so you have to apologize for that. I have so many numbers in my head. But of course, you can give us a call at 222-8261. That's 222-8261, as well as 314. That's 314-9975. And of course, any of those numbers, you'd be able to get someone who can direct you to the Tobago office. What we're going to do most likely during this session is at the bottom of the recording, we'll actually place those telephone numbers for you. So that was the first question that we answered. The second question we got is someone asking, as it relates to insomnia, how does insomnia relate to PMS? Okay, now I would have discussed PMS on a number of occasions. So the first question is, what really is PMS? PMS is an acronym for postmenopausal syndrome. I'll go again. So PMS is an acronym for postmenopausal syndrome. Now, what is menopause? Menopause is when a female has reached a point in her life where she no longer experiences ovulation and a menstrual cycle. So she no longer, or she ceases having her period. Now, scientifically, a female is considered to have gone through menopause when she has consistently not seen her menstrual cycle for 24 months, which is 2 years. Good. Now, we kind of have some what's the word I want to use, boy? A bit of debate here, because we have so many women now who have problems with hormonal imbalance that a lot of the times they could not see the menstrual cycle for 2 years and have not gone through menopause because of having a hormonal imbalance situation where they have a lot of problems with irregularity. So in a case like that, if we need to determine whether you have in fact gone through menopause, it's a simple hormonal blood test that we could do that would indicate that you have ceased having a period and you are in fact in menopause. Now, notice I said we're discussing PMS, which is postmenopausal syndrome. So the acronym post stands for subsequent or after. So we're speaking about women who may have gone through menopause already, and they may have had a good experience, or they may have had a bad experience. That experience may have passed. So let's say 2-3 years may have passed, and now they have reached the point where they are experiencing certain types of symptomology, and I'll explain to you what symptomology they would usually experience. So what you find is that women who have serious hormonal challenges as a result of postmenopause or even menopause or even premenopause, they all experience the same symptomology. Example, insomnia. What is insomnia? They have the serious problems or inability falling asleep and actually having a good night's rest. That's one. Two, they have problems associated with depression. What is depression? So depression is a state of mind where you don't feel too good about yourself. You don't feel to go out. You might confine yourself to the house. You don't go out too often. Feeling of unwantedness. You may have feelings associated with hot flashes, feelings associated with irritability. So you're always upset here. If you do have a partner, married, common law, whatever the situation is, you tend to be very sometime-ish, as they say. You're not in the mood for persons. Physically, women who experience that could have problems with vaginal dryness as well. So as a result of that, they don't really feel to engage in intimacy. And of course, those things could cause problems in marriages and that type of thing. The unfortunate thing is a lot of women out there do not understand or don't even realize that they are, in fact, going through what is known as post-menopause. So what I will advise you to do, if you are a female and all of a sudden you're experiencing things like insomnia, depression, anxiety, or what is known as a panic attack. So what is anxiety? Anxiety is when you literally feel as if your heart is racing off. So maybe in the middle of the night you may be sleeping and all of a sudden you get up with this, your heart pounding in your chest, you're sweating and you're feeling anxious, severely nervous, severely sweating, issues associated with muscle weakness in your legs. Those are also symptomology associated with post-menopause. Good. So that's some of the things to look at. What are the advantages of what we offer at Batson and Associates? Numerous. Because at the end of the day, remember, we are not dealing with the symptomology, but we are actually dealing or addressing the root cause of the problem. So one of the things you need to look at, of course, is your gastrointestinal system, the gut. And a lot of persons do not understand how gut health actually affects the body in its entirety. Keep in mind that with gut health or poor gut health, what you end up having problems with, you have problems with your body actually absorbing or assimilating the food that you eat. And you also have problems with your body eliminating waste. Now, how could that cause problems? That could cause a number of problems because you end up with what we call auto-intoxication. The prefix auto meaning self and intoxication meaning poison. So your body is literally actually poisoning itself. So that's something that you need to pay very, very close attention to. So as it relates to those two questions, based on the time we have, those are the two questions that we're going to address. So if you're someone who has been diagnosed with diabetes, it could be for years, and you have complications associated with diabetes, for example, diabetes or diabetic neuropathy, which is pins and needles, cramping in your calves, burning under your feet, then of course, feel free to give us a call or visit us at Batson and Associates. As regards to the situation associated with PMS, a lot of women experience serious problems during PMS and they're not aware that it's PMS they're actually going through. Another good example, you might find women have problems where they have high blood pressure, but what they really have is secondary hypertension, which has a primary cause, and the primary cause is hormonal disruption. So that's something that you need to pay very, very close attention to. So let me, of course, again, share those telephone numbers. That number you can call us on 222-8261. That's 222-8261. And of course, the WhatsApp, you can WhatsApp us on 314-9975. Again, that's 314-9975. The location of that office, we are located at the Triangle Building in Scarborough. That is, of course, opposite the WASA building there. Very easy to find. And remember, at Batson and Associates, we are integrative consultants. So we also have that blood analysis and magnetic resonance analysis scan. You can, of course, call the office, make the appointment, and we do have consultants in Tobago every other week, and I myself would be here. I'm usually here once for the month, so most likely for a week I usually come, and we can actually have you evaluated and, of course, work on those things. So remember, as we always say at Batson and Associates, if you think health is expensive, try sickness. If you think education is expensive, try ignorance. So do enjoy the rest of your day. And that comes again from Batson and Associates.